Okay, well, welcome to our 2025-2026 Preceptor Training. We've got some updated slides for you from eValue and many other things. So we'll go ahead and get started. So obviously, we're in our second year of the master's program. We have two cohorts now in full swing. We have our first years from last year currently in immersives, and they're doing very, very well. They've completed, obviously, a couple of immersives this fall, and we'll be heading into more immersives in the spring, and they are doing extremely well. Um, Obviously, we had a new cohort start this summer with a total of 5 students, which is absolutely fantastic. So are growing as a program year over year. And we want to thank all of you, obviously, as preceptors for being a part of that. Uh, and you have a vital role in the development of our students. So, as a review, and for those of you that have been with us before, you know that um, as preceptors, we are. Your job is to supervise and engage our students in clinical education. And all of you, regardless of where you practice, whether that's here in Minnesota or whether elsewhere, are required to be licensed and credentialed in your respective state in which you practice. If you are an athletic trainer, you are required to be certified by the Board of Certification and also be licensed in your state of practice. Obviously, our preceptors for athletic training clinical experiences must either be athletic trainers or physicians. We'll talk about that more in just a little bit. We do obviously in our program have experiences that are supervised by other providers, uh, nurse practitioners, physical therapists, and others, and those are termed supplemental clinical experiences. As a reminder, as many of you have already done, all preceptors are responsible for maintaining an up-to-date BOC certification, license, NPI number, and CV and resume in our online management system, eValue. And we'll talk a little bit more about that system as we've had new updates this year as well. And then obviously, all of you are required to update your contemporary expertise table yearly, and we'll discuss that here in just a second. So, for those of you that may be new to our program this year, we are continuing to utilize eValue this year as we've done in the past. And this is a system that allows for organization and management of all of our uh, clinical education related and program related documents and processes and procedures. eValue is a program that's utilized by med schools, PA schools, nursing, and also athletic training programs. All student evaluations, time logs, and case logs that students submit and that you sign off on will be handled in eValue. Uh, all of you as preceptors have currently been added to eValue, and you'll be receiving an email uh, if you have not already. Okay, so this is your dashboard. So if you are new to eValue for the first time, this is what you'll see upon logging in. You'll see here that if you log into your homepage, you'll see your dashboard here on the left-hand side. You have a calendar with your information. In the middle, this is going to be uh, your urgent tasks section. Any evaluations or time logs and or patient encounters that you'll need to sign off on will populate right here in the middle of your screen. Um, and then obviously any other tasks as well. On the right side of your screen, you will have uh, access to competencies, the preceptor policy and procedure manual as well as a link to the contemporary expertise form if that is something that you have not filled out. In the event that you already have, all you'll need to do is update that and send that over to us. So let's chat a little bit about contemporary expertise and what that is. Obviously, these are routine areas of athletic training practice, prevention and wellness, urgent and emergent care, primary care, orthopedics, rehabilitation, behavioral health, pediatrics, so on and so forth. This can be, right, within athletic training, these are common areas, but this can also be your chosen profession or area of practice. If you are a nurse practitioner, physical therapist, so on and so forth, right? So it doesn't necessarily have to fit within these domains that we've defined for athletic training. So generally speaking, an athletic trainer or provider may choose to specialize in these areas, in any one of these areas, and I'll show you in a second um, how you're able to essentially back this up with your contemporary expertise table. Ideally, your role in the program as a preceptor should be directly related to your contemporary expertise, and so we'll talk more about that. So, obviously, if you're new to putting together your contemporary expertise table, um, you may want to think about what goals that you may have for your professional development as an educator or clinician, right? What area of specialization, for example, maybe speaks most to your role in the program? Maybe that's primary care, maybe it's orthopedics, right? Depending on your setting. What do you feel like you bring to the table based on what you do every day, right? Um, and ultimately, you know, the goal is to really kind of try to put into words in your table, right, how what you do every day and your goals meet each other, right, and how you can marry both your work responsibilities and your clinical practice with your goals. And that is how we define and support contemporary expertise. So how do we achieve contemporary expertise? So there are different ways that you can accomplish this. One way of doing so is through advanced education. Maybe you went through a degree program, whether it be a master's or a doctoral program, right? You may have experience in this area. Maybe it's an area of clinical practice that you are involved in on the daily, right? Clinical research is another way, and or other forms of scholarship. Maybe you've conducted some other research and or maybe written a lit review, for example, over a specific area. And then there's obviously continuing education mechanisms, conferences, CEUs, so on and so forth, that many of us have access to throughout the year. So we would like your contemporary expertise to be current within 3 to 5 years to reflect best practice, right? And so it could be right that ultimately we are looking for quality over quantity, but you may have maybe smaller activities that you've completed over the years, and or maybe one substantial activity, like maybe a residency or a fellowship or even a research area that you participated in that could support that. So here's an example. What does this look like? This is my contemporary expertise table with some of the conferences and training that I have done in the past. So you can see that I've listed, right, my areas of athletic training expertise, right? Those are primary care, orthopedics, rehabilitation, and diagnostic ultrasound, right? And so you can see that what I've done here is I have, for example, this first talk that I went to June 24th, 2024 at our national meeting that year, right, which is called Strategies for Acute Wound Management. And ultimately, I gave this the name and date of the meeting, where it was located, and then the explanation. Okay, and we'll talk more. So ultimately, said that this was a mini course to review the foundations of acute wound care, dressing types, as well as application and removal of sutures and staples, and the relevance is primary care. We'll talk more about relevance in a second. This is actually extremely important, and I've got a slide here in a little bit where we kind of try to really spend maybe just a minute talking about how important this is and how we should all try to, when writing our contemporary expertise tables, to really kind of try to establish and expand on that relevance. Okay. Same thing here. I did a small course on blood flow restriction therapy at our Minnesota Athletic Trainers Association meeting in April of 2024. So again, here we go. So, continued activities here, right? Obviously, had, I went through a diagnostic ultrasound training, as you can see, and then obviously a couple other meetings that I've attended, conferences. This obviously falls under the diagnostic ultrasound category, and then obviously primary care and orthopedics. Um, okay, let's talk a little bit about relevance. Okay, so what I've done is I've kind of blown up a couple of uh, courses that I went through. Um, and what I want to draw your attention to, for example, in this first one, strategies for acute wound management, right? Obviously, we've talked about, um, you know, what um, what the course was, but uh, I've explained this, right? So it says continuing education explanation, or I'm sorry, contemporary expertise explanation. Okay, it says that this mini course reviewed the foundations of acute wound care dressing types, as well as application and removal of sutures and staples. The relevance here was primary care. Additionally, right, it's important to note uh, how this how how you would utilize this in your practice, right? So as far as relevance goes, how exactly do you feel that this contributes to your practice? So in this case, right, primary care, this is going to contribute to my practice via maintenance of knowledge and skill in acute wound management. in regards to application of sutures and removal of sutures, so on and so forth, right? Um, and then same thing with acute wound management down here. So um, we've done this previously, obviously with a letter, but you are welcome to obviously include this in your table, right? And it's important um, for you to obviously keep this on hand for yourself year to year, but also send to us so that we can upload to your file any value. All right, so this is relevant for athletic trainers, and I'll play this briefly. We are currently still under our current senior reporting system, but that will be changing in the coming year or two. So this is just a quick little video for athletic trainers and how this might impact preceptorship.
Hello, I'm Brian Conway, Certified Athletic Trainer and President of the BOC. Today I'm proud to share an important advancement in how the BOC supports our Certified Athletic Training professionals. As many of you continue to meet requirements for the current renewal period, we have an announcement that will impact your next renewal period. Early in 2026, the BOC will launch an innovative, flexible, and customizable certification renewal program designed by athletic trainers for athletic trainers. The new option, Continuing Professional Certification, will be known as CPC Renewal. It has been built to support your professional growth in ways that matter most to you, your goals, your career path, and your patient care. It offers flexible options to meet your needs. Certification should do more than just validate where you've been. It should empower where you're going and integrate into your daily work. To help you learn more about CPC Renewal, we're offering 2 live webinars. These important sessions will introduce CPC Renewal and provide an overview of how this new option can be tailored to fit your certification journey. Check the email below for further details and registration information. Thank you for your continued dedication. We are honored to support you today and into the future.
So a little bit of background, obviously, of our program. Clearly, we've made our transition at this point from a bachelor's program to the master's program. But really, as a liberal arts institution, right, our mission within the athletic training program is to provide students with a comprehensive learning experience that leads to mastery of athletic training skills while developing students who both professionally and personally engage and serve their communities, right? And we achieve this by the Gustavus core values, right? Excellence, community, justice, service, and faith. And we encourage them to inculcate these things into their lives. And we additionally encourage our students to practice culture humility. We'll talk more about that in a little bit. And obviously engage in ongoing self-reflection and respect for diverse perspectives. So as we've changed the program, right, our outcomes have also developed and changed. What are the outcomes of the athletic training program that we are expecting our students to meet? So the first one is excellence, right? We're expecting that our program will prepare students for the BOC exam, job placement, and upon graduation from the Masters of Athletic Training program or the MAT, right? And help them provide high quality didactic and clinical education based on the best evidence. They should engage with the community and provide service, right? They should advocate for and engage with the profession of athletic training and foster leadership qualities. Promotion of justice, right? This is promoting equitable and culturally humble athletic training education and healthcare that will be necessary for them as they encounter patients of all perspectives and backgrounds. And then integrating faith, right? Promoting professional and ethical conduct of athletic trainers and athletic training students is also a key part of that. So let's talk about clinical education, right? So as all of you know, clinical education is a broad umbrella term that includes 3 types of learning opportunities for preparation, right? And generally speaking, those are athletic training clinical experiences where the vast majority of you will interact with students. Simulation, which is something that we as faculty do, but it's something that you as preceptors can also do with students, right? By setting up maybe a scenario that they might walk through that may not involve an actual patient scenario, right? And then obviously supplemental clinical experiences with our other advanced practice providers, such as our nurse practitioners, PAs, and our physicians as well, and physical therapists. All right. So Obviously, with our athletic training clinical experiences, those that are directly supervised by an athletic trainer or physician, uh, that care should be guided by a preceptor who's an athletic trainer or physician, right? With our simulation, right, this is an educational technique, like we mentioned, not a technology, right, to replace or amplify real experiences with guided experiences. I think all of us have potentially had this experience when we potentially practice a skill, right? Maybe a new skill like dry needling, like in a course, and or maybe we've utilized a mannequin just to get the first few sticks when starting an IV. Right, these are all simulated experiences uh, that allow us to replicate some aspect, right, of a real world experience. And then we have our supplemental clinical experiences, right? Those are learning opportunities supervised by healthcare providers other than athletic trainers and physicians. And all obviously based on the experience, our students are able to uh, take away from that depending on the background and content of that experience. So the other thing that's also extremely important is that our clinical experience has to follow a logical progression that allows for increasing amounts of clinical supervised responsibility that can lead to autonomous practice. So how does that actually work for us as a program? One of the ways that we often find is that in year one, and we'll talk more about this, we utilize competency-based education to both guide our students in skill, but then also to essentially confirm that they are in fact able to perform that skill, right? And we hope that after they have, uh, been trained in that skill in class, that they have real opportunities to practice and integrate that knowledge and skill and decision making and professional behavior, right, on an actual patient. And we do. We want our students to be able to practice with different patient populations and care providers, right, in various health settings, because this is going to mimic their actual real life practice and what they are doing from day to day uh, in their clinical experiences and later on in their jobs. One thing that we will talk about more in depth, and I think this goes without saying, that our students cannot and should not, and nor should any of us, discriminate based on sex, ethnicity, religious affiliation, or sexual orientation, right? Um, so our sites are evaluated by the ATP, by the program on an annual basis, uh, and this serves as an overall part of the evaluation. Uh, our students have to be instructed on clinical skill prior to performing that skill on a patient. Generally speaking, they have been trained on the skills in class, right, and should be able to do them with you in clinic once they've been signed off. In the event that you as a preceptor have an additional skill that you would like to teach a student, we do have a form that can be completed in eValue in order to facilitate that. So as far as clinical education, right, obviously at no time are our students meant to replace professional staff, right? Our clinical education experiences must be educational in nature, so students don't are not meant to create a workforce or replace professional staff. Um, and ultimately, the number of students assigned to a preceptor should ensure effective clinical education and safe patient care. Uh, Many of you who have served for us as preceptors on a regular basis, very often we will work with you to establish the appropriate student preceptor ratio that you feel comfortable with uh, in order to provide the best educational environment, right? And one thing that we are that we also take very seriously is that we try to make every possible uh, opportunity for there to be regular education or I'm sorry, communication and education, right, between the program and the preceptor. We've also had this year several preceptors join our actual weekly faculty meetings, and we would invite you to join us if you were so inclined. It's an incredible experience, I think, for our preceptors to stay plugged in with what's going on within the program and to just have weekly updates from week to week. So we have had a new and evolving clinical education policy since our previous site visit in March of 2022. We do have a new policy that was developed to display uh, log- a logical progression to our clinical experiences. This ensures that our students explore many different aspects of athletic training while simultaneously working towards autonomous practice. Um, and we have developed these emphases over the course of their 2 years in the program. So, uh, And those themes, as they're broken down over 2 years, are expose, explore, expand, and examine. Right. So year one of the master's program, expose and explore. So students learn the ins and outs of athletic training practice in several settings: collegiate, secondary school, and in physician clinics, both general medical experiences and orthopedic clinic as well. Their pre-season experience of the month of August is their first immersive experience in year one. They generally spend approximately 19 hours a week or more, right, in this immersive experience in year one in the month of August. Their experiences in their first year range anywhere from 4 to 7 weeks in length. They have exposure to various sites and preceptors, which allows them to obviously explore a lot of different paths within athletic training. We've had students that have thought that they wanted to do collegiate athletic training, but then spent time in a secondary school and absolutely fell in love with the secondary school, right, and or clinic, and vice versa, right. So all of us have had those experiences, and that's nothing new for our students, also, right. We do have another experience that's new to the program, to the master's program, called the Choose Your Own experience, and this essentially is meant to be a warm up, right, for their immersive experiences in year two, and this allows them to choose a relatively local uh, but comprehensive experience that they want to explore towards in the spring, winter to spring of their first year, and that allows them to gain a broadened perspective for their immersives starting in the summer. Expand and examine. So in year two, right? This is where our students are now in immersives, right? They're no longer on campus with us several times a week. They are now out at their clinical sites, and their courses are generally moved online. So the experiences in the second year are meant to allow more contact with diverse patients, build trusted relationships with the preceptors, and for them to learn the day-to-day function of the clinical environment, right? And many of these experiences are tied to their courses in year two. Uh, for example, ATP 522, which is healthcare administration. Um, we do have two on-campus retreats that take place within the first and second year, and those happen in the months of August and January, where we bring our second year students back uh, to allow them to not only practice a skill, but to also prepare for the VOC, and to also network with our first year students. So as we talk a little bit about diversity, equity, and inclusion here at Gustavus, we have obviously adopted an updated statement to further solidify our commitment to diversity, equity, and inclusion, and its implementation within our program. So our ATP is obviously committed to increasing diverse perspectives within our program that arise due to cultural and personal circumstances. We want to ensure that our students have the opportunity and the access, right, to see patients of diverse backgrounds, but to also confront, when needed, and challenge the negative effects of bias, harassment, and discrimination. Uh, and we as a program do take pride in welcoming those of diverse experiences, and we try to tailor not only our curriculum, but also our clinical experiences in such a way where our students are meeting patients of diverse backgrounds from day one. So our students, right, we emphasize very much ethical practice within our program, and we would hope that our students should, right, report any behaviors that they see within their clinical experiences that run contrary to ethical practice, particularly those that are not in step and or disrespectful of any diversity, equity, uh, or inclusion-based uh, components of their experiences. So our students do sign an updated DEI agreement every single year with any value, and this is a part uh, of their required onboarding for the program every year. All right. So clinical expectations, as we've talked about, our students have expectations that they are required to complete for us on a yearly basis prior to starting their clinical experiences. Our students have personal records packages that they are required to submit for us on a yearly basis. Uh, and that all happens electronically in eValue, student handbook, statement of agreement, or confidentiality agreement, technical standards, which essentially is them certifying that they have both the mental and physical um, capacity to meet the requirements of the program. But if they cannot, that there are potentially reasonable accommodations to allow them to meet those requirements as they're able with accommodations. Our communicable disease statement, right, and then our DEI and social justice statement, current emergency cardiac care, bloodborne pathogen training, and then Preceptor training. Uh, they do upload all immunization records, Hep B, our annual flu vaccine, and then COVID-19 vaccination sequence, and any annual boosters that they might have received. They do get a yearly tuberculosis test, generally in September, within our program, and then obviously all of them are required to pass a background check. Okay, clinical experiences. What are the students supposed to do, right? What are the students' responsibilities within their clinical experiences? So all of our students are required to track both their hours and patient encounters in eValue. They will be required and responsible for logging those hours and patient encounters every single week. And those hours and encounter tracking are tied to their grades. Those are tied to their grades for the clinical education courses and ATP 551 through 557. That is our main clinical education course sequence that our students undergo throughout both, or that they have throughout both years. Okay, back to your dashboard, right? This is your kind of your uh, your kind of your central location for eValue once you log in. And so we can see here that we've got some student sign entries to sign off on. We can see that circled here in red, right? And then we have the evaluations above that as well. So let's talk about time entries, okay? So if you look at on our slide here, if you were to click on that link that's circled in red in the previous slide, it'll take you to the calendar, right? And it'll show the students that have entered those time entries for the given week. Or time period. You'll notice here that a time entry that has not been approved is going to have a red exclamation point next to that, right? In order to approve that, all you have to do is simply click the circle, and that will become a green check. Once you have clicked that and it's become a green check, then that time entry has been verified. There's also an additional button at the top that says verify all, where you are able to obviously verify their hours in mass. Okay, what about patient encounters? So obviously back on your dashboard here, you can see that we have some case logs, okay, to sign off on. So back on the dashboard here, and here we have 10 that need to be signed off on. So we can click on this hyperlink here that says sign off on case logs, and that's going to take us to the next screen. Okay, and once we do that, we're going to select our site. Okay, so you can see we have these drop-down menus here, right? And you'll select your clinical site, and the rotation experience group is going to be clinical experiences, right? And then we're going to click on, and you can leave these active diagnoses. You can just leave that there, leave that as is. Select the student that's a part of your rotation currently. So you'll select the appropriate student, right? And then you'll click next at the bottom. And once again, ensure that you have clinical experiences selected as the rotation group at the top. So that's going to take you to this screen. You're going to see various patient encounters that have been submitted by the students, right? And you can see here we have the radio buttons on the right side that allow you to either confirm or reject a patient encounter that the student has submitted. So you can either just click on the radio button to confirm that, and then you're off to the races, right? And you click Save Changes at the bottom. In the event that you want to confirm all and/or excuse me, that you want to confirm all of those, once you can simply click confirm all and then save changes at the bottom, and that will obviously confirm all of those patient encounters at one time. Okay, clinical education code of conduct. Okay, so obviously our students are there, our experiences should be educational in nature. And that also falls on the student. The student should be prepared at all times. They should be on time and be engaged, right? And they should be engaged with their patients and supervisors and other students. We also expect them to be professional with the patients that they're interacting with. In the event that is not happening, please reach out to Mary or myself, and we will be happy to address that with the student. Our contact information is included on one of the slides towards the end of the presentation. Clearly, obviously, we want our students to obviously maintain appropriate demeanor for a healthcare facility. This includes dress code, how they're dressed, right, how they conduct themselves. They should be prepared to provide care for patients and be helpful and assist clinical staff as needed with patient encounters. They should be helpful, polite, and respectful, right? We expect them to be on time. And they must, as we've talked about, right, record their hours and track their patient encounters. Um, and obviously, you as the preceptor are setting the expectations for them at your site, right? So we expect them to follow those expectations that you set for them. In the event that that is not happening, please feel free to reach out to Mary or myself so that that can be addressed. All right, preceptor responsibilities, friends. Clearly, right, one of the primary roles of a preceptor, right, is to directly supervise students during clinical education and be able to intervene for the sake of patient safety. That doesn't mean that you have to be over their shoulder all the time, micromanaging everything that they do, right? In the event that you're confident that the student is capable, you're able to obviously give them a longer leash to complete, you know, many, several, and or an entire patient encounter with a patient, and we encourage that as much as possible because that is ideal. But the bottom line is that you must be directly available and or accessible to the student, uh, particularly to be able to intervene for the sake of patient safety. Um, you may find that the student asks you about things that they've been taught in class, and you may be able to provide instruction and or assessment of their current knowledge and skills and assessment and abilities, right, as designated by the KD. No longer are preceptors required to sign up on competencies. That's something that Mary and I and Claire have taken over as faculty. And so you are welcome to review competencies with students, but it's not something that you're required to grade any longer. Uh, and one of the biggest, obviously, uh, parts of a clinical experience is providing opportunities for instruction, right? Providing those opportunities and those teachable moments for them to develop clinical integration and communicate, obviously, skills and clinical decision making during actual patient care scenarios. All right, and then obviously helping them facilitate, right, clinical integration of skills and knowledge and evidence, right, in the practice of athletic training. And a lot of times that can just happen via a debrief, right? Maybe you see a patient that with them, or together, and maybe after the encounter, you just kind of go and talk about, hey, let's talk about this patient. Um, what do you think about that diagnosis, and or what do you think about the plan of care? A simple debrief can go a long way in helping a student comprehend and understand not only maybe the pathomechanics and or the pathophysiology of a disease or injury, but can also help them develop the clinical reasoning necessary, right, to be able to facilitate an appropriate plan of care. Clearly, as a preceptor, we also expect you to demonstrate understanding of and compliance with our policies and procedures through doing things like attending this preceptor training and watching this training, but then also communicating with us in the event that any questions arise. We are your go-to for any questions or concerns that you may have in regards to the program. And it is our job to answer questions for you and be available to you as we are able. Okay, so let's talk about these goal forms and eValue that you will see as a preceptor. So let's talk about the student preceptor goal form. So this is an example of the student goal form. So as you open this up, if you log into your dashboard and see that you have an evaluation to complete, maybe it's the goal form for an experience, okay? You will likely see that once you open that up, you have the student's goals there in front of you, and you'll notice that we have our questions in bold on the outside, followed by the student's goals here, and those are displayed horizontally here, 1, 2, and 3. So the student obviously responds to each question here, giving 3 goals for each question, right? The goal, right? How those are achievable, and then the time frame for achievement of that goal, right? So you as a preceptor would go in and review the student's goals, and this is where with question number 2, where this becomes essentially um, your ability to answer those questions, right? So question number 2, having to read the student's goals, do you believe that those goals are relevant and achievable during the experience? And you could say yes or no, right? And if you think they are, right, do you believe that they can be successful in achieving their goals, and how so, right? And so you can provide a response down here in the box. So you can see, obviously, as we continue to work through, obviously, you can give your goals for the student as well, right? We have 2 goals that you can provide, 1 and 2 here, horizontally across the page, right? How do you think you can help them achieve those goals? And you see those responses here, right? Time frame for those goals, and then how can you as the preceptor help the student be successful in achieving them, right? And so those are all responses that you can provide in your section of the form. Okay, super important. Question 5 on the form. Okay, this is one of the primary responsibilities that the preceptor has, is orienting the student to their site. So you can see if we look at this, if we look at question number 5 or this form, that we have in bold, right, that the following items here across the top are our emergency action plan, uh, and the student's role in that plan, bloodborne pathogens, communicable diseases, documentation policies and procedures, and then HIPAA, FERPA, policies and procedures, and then a plan for clients to be able to differentiate clinicians from students, right? That we need to discuss them. And then obviously that you will also send any updated policies and procedures to us on a yearly basis, so that we can upload those into eValue. And then those are boxes that you simply click on the evaluation form, and you can connote those with an X once they're clicked. Okay, a new form that we have for you as well that we would ask you to complete, and I'm happy to send out reminders to you as needed. We have a clinical demographic form that's relatively new to us. So we've done this previously um, as a Google sheet. However, it's now been imported into eValue. Um, so with this form, right, we are looking to prove or looking to support, right, to the Katie that our students are in fact seeing patients of various demographics and backgrounds. So as an example, I've given you our performing arts clinic, right, as an example. So this is going to ask questions right in regards to gender, age, primary language, so on and so forth. So we see that around nearly 70% of our patients, right, excuse me, in our performing arts clinic are cisgender women. Um, so if we were to continue to scroll on this form, we can see that question number 3. Oops, sorry. We can see that we'll continue to have questions, obviously, in regards to their primary language, and their insurance status, right? So ultimately, it's not that we expect you to know what type of insurance they have, right? But it's that we hope, right, and we would, maybe what percentage of your students, maybe or of your patients either don't have insurance, or maybe would qualify for a government plan, right? And so you'll simply just scroll through and just indicate the answers to those questions. All right, so we do have our end of experience our mid experience evaluation. I'll go back to that in just a second, but I do want to touch on um, our mid experience form really fast. So our students are going to be required at the midpoint of most of our experiences. The exception being many of our physician clinic experiences, where our students are do not have to complete a mid-experience form due to the length of the experience. Right, so our students will go in and click whether or not they've achieved their selected goals, um, and we're going to ask them, right, on the mid-experience form, do you believe that you've achieved your first goal, and what's an example of an encounter that helped you achieve that goal, right? Yes or no, right? And then as a preceptor, you can respond to that question over here in the box under the green heading, right? Which goals have they achieved that you set for them? And how can you, and if they haven't achieved that yet, how can you as the preceptor help the student achieve that goal, right, by the end of the experience? So now, okay, end of experience evaluations. You as preceptors will complete one final evaluation of the student at the end of the semester, or at the end of the experience, excuse me, with an emphasis on their clinical skills, professional qualities, and their foundational behavioral practice, right? So we have questions, obviously, there's 17 total questions. Here's a question 1, right? So you're going to select their main population or gender that they were involved with during the experience, and whether or not you believe the students achieve those goals, right? So you can see as we work through here, which of these skills do you see them? Do you see them maybe complete during the experience? As far as our grading scale, okay, here, excuse me, within the athletic training program, you're going to see that we have theoretically a 3-point scale with a critical deficiency at one end, meaning that they are unable to perform the skill, or maybe it's something that you weren't observed, that you did not observe from the student. So essentially, our students are should, we at least hope, within year one, should be around level 2. Our level 3 uh, score here is essentially means that they are ready for autonomous practice. And this is something that we would expect our second year students to be getting close to achieving. Um, but if we can get our first year students close to level one, ideally level 2, right, with many of these skills, that is where we would like them to be. And so you can see that as we scroll through here, we have various different skills that they have should have been exposed to, or maybe that they've either uh, utilized on a patient, or done on a patient, or not, right? Obviously, professional qualities. How do they deal with communication, both verbal and nonverbal? Interest in learning. Are they enthusiastic about the experience? Are they resourceful, punctual, right? And you have the ability to select their score here, 1 through 3, either critically deficient, meaning that this is non-existent in regards to the student, or it's something that you didn't observe for whatever reason. Okay, and as you can see here, moving on, foundational behaviors of professional practice. Okay, primacy of the patient, teamwork and patient care, right? Legal practice, ethical practice, their ability to advance their own knowledge and show initiative to advance their knowledge, cultural competence, and then professionalism. All right, something that's new that we're trying to do more of this year, student portfolios. So let's say that you're going to have a specific student with you throughout the course of an experience. So this is Joe. Everybody loves Joe, right? And this is Joe's student portfolio. So if we pull Joe's student portfolio up in eValue, you can see that what we have available here is basically a log of Joe's hours that he's completed. He even has a resume here for us to review. He's given us a personal summary here, and also obviously, uh, as he completes goals and other things, those things can populate on his portfolio for you to see where has Joe been, right? And what kind of work has he done, and what are his goals and dreams, and how have his clinical experiences contributed to that, and how can you help as a preceptor as he moves forward in his education. Competencies. We talked about this briefly, but obviously, as faculty, Mary, Claire, and myself have taken on the assessment of competencies with students. That's something that preceptors are no longer required to do, right? Preceptors can obviously practice competencies and skills with students, but once again, they are not. It's not something that they need to obviously formally grade or check off on. Competencies are obviously graded on a scale, as we've seen, 0 to 5 on paper. However, as we've talked about, right, 5 is an expert and 4 is advanced practice. So we're looking for them to be at a 3, as this is the benchmark for independent practice, right? And as you've seen in our previous evaluation, that is the benchmark. With our final evaluation, our students are only able to achieve as high as a 3, right, on their end of experience evaluation. So all of our competencies are listed on eValue. You'll find those on the right side of the screen towards the bottom. And as they complete them, they will pop up here, and you can literally click on them and see what the students have done and what they've been signed off on. Okay, let's talk for a second about proficiency assessments. Proficiency assessments are an opportunity for our second year students to complete varied scenarios, right? Various different topics and aspects of patient care, whether that's mental health, general medicine, concussion assessment, lower extremity assessment and rehab, so on and so forth, right? Uh, by utilizing a proficiency assessment, right? And there's 20 of them, and they're able to go through and select one, and then they go through and essentially fill that out, and then you as the preceptor, right, are able to go in and assess their level, right, of preparedness, 1, 2, or 3, or hopefully not, but potentially critically deficient in some cases, right, in a certain area. So 1 being minimally proficient, 2 being moderate proficiency, and then 3 being full entry-level practice ready professional proficiency, right? And so as we scroll through, you'll have a total of 26 questions to answer, and then at the end you can make final comments here. What are their greatest strengths on that proficiency assessment that they complete with you, and what are 2 to 3 areas of improvement that you might see? So once you have completed that and been able to respond to that, you would click submit. Or maybe if you're not ready to submit that just yet, you can save it for later, and it will stay on your dashboard for completion at a later time. All right. I am sorry that I don't have a picture of Claire, but she's, I was not able to get a picture of her for you, so I apologize for that. But um, all of you have here in the PowerPoint Mary's contact info, both office and cell, mine as well, with our email addresses, and then Claire's contact info. Please feel free to reach out to us at any point in the event that you have a question or concern. As we've talked about, any disciplinary concerns or actions should be directed to Mary or myself. Um, Additionally, we also have a brand new administrative assistant this year, Jesselyn Mercado. She is our administrator of record and e-value. So you will be getting emails with Jesselyn's name on them. She's going to assist in tracking evaluation forms and making sure that students are completing these in a timely manner. So you will see her name come across your email inbox not infrequently when a student completes an evaluation. Pardon me, with a reminder to complete an evaluation if you've not yet done so. Whether that be goals and or mid-experience or an end-of-experience evaluation. As previously mentioned, please direct any disciplinary concerns to Mary or myself. So you do have, obviously, as a preceptor, you have the ability to gain 5 Category B CEUs every year per academic year, right? For serving as a preceptor, the minimum is 200 hours a year in order to obtain those 5 CEUs. You do have a minimum number of hours that you have that the students have to complete with you, or that you have to complete with the students in order to be able to qualify for that, right? And there is a form linked in eValue for you to complete. That is an ad hoc evaluation. I can also send that out to you in the event that you want to submit for CEUs. The reporting date for the BOC has changed this year to February 2nd, I believe. But if you could get those if you could let us know that you need those by January 12th, we can get those out to you in order to submit those in time for your reporting period. In the event, also, a reminder though that your BOC, your yearly BOC fee is due on the 31st of December, but that CEUs are not due until February. Thank you so much to all of you for taking the time to watch this presentation. Thank you for everything that you do for our students, and we look forward to working with you and continuing to build relationships with you throughout the years as we work together. Thank you so much.